Okay, so we're going to start out by taking a range of motion measurement on your knee. So I'm going to have you bend that knee for me as far as you can comfortably. Okay. And we're looking at 130 degrees of bend. I'm going to have you straighten that leg for me as straight as you can. We're going to press down as hard as you can. There we go. And that's at 0 degrees, which is full extension, so that's really good range. So today, we're going to be showing a device called the GapFlex. It's gravity-assisted passive flexion. It's a device developed to help patients regain range of motion following knee replacement surgery. So what we're going to do first is raise the leg that you had the knee replaced to them. We're going to drape that knee right over the pad right there. So the principle behind this device is that the weight of your leg and gravity helps to bend the knee over the pads. Typically right after surgery, when the pain block is still intact, most surgeons will remove the multi-layers of foam and allow the patient's knee to fully bend to show them how far they can actually flex the knee. In a situation where the patient's knee hits the frame or hits the bed, you'll need to elevate the GapFlex by pulling the pin and raising the bar. And we'll place right back behind the knee. So it's just a nice stretch there. The GapFlex pad pushing on the back of the knee actually allows the knee joint to separate and stretch without compressing the joint like current technology does. So after the pain block is worn off, we'll typically put these layers back on here, which will allow the knee to be limited in how much flexion can occur. Right here with the 4 layers of foam, you're looking at approximately 90 degrees of flexion. And as we pull off each layer, you can see that it will allow an additional roughly 10 degrees of flexion added to the knee. So let me pull off one more layer here. And then the final layer here. Okay. So the treatment will last for 6 minutes. The only time the patient would come off the treatment is if they started to experience any pain in the lower extremity, numbness or tingling in the lower extremity. The treatment would stop immediately at that point. Once the patient has completed the 6 minutes on the GapFlex, they would get up, ambulate for approximately 2 minutes, and then they would move to the GapFlex extender box. The GapFlex extender box is a foam block that has a heel cut out here. And so I will put this underneath the heel, and that will let the weight of the leg drop down and extend that knee. This portion of the treatment lasts 10 minutes. So the complete treatment is 6 minutes on the GapFlex, 2 minutes of walking around, and then 10 minutes back on the GapFlex extender box, and that will take place 6 times a day.